It has the constitutional mandate to protect the interests of Nigerians and Nigerians. It has the constitutional power to summon anyone in this country to appear before it and explain his or her role in an intractable issue such as this. But I believe that there is commitment on both sides to ensure that we find a common ground, find a lasting solution, define the parameters of the engagements, and move forward with the actors that are on board so that we don't have to go and start de novo. So for me, therefore, my role is just to encourage all parties here to be transparent and make their contributions in a way that will provide a solution. It does not mean we will not take some time to understand the past so we know how we got to where we are.
UNOPS cannot, and we've asked them repeatedly, can you go back and use that entity? And UNOPS told us categorically no. So the alternatives before us is we say, let the agreement lapse, let the money revert, nothing happens, but 5 states of Nigeria suffer. The second alternative is to say we find another procurement agent because the agreement with the Islamic Development Bank, there's a legal opinion signed by the Attorney General on the basis of the negotiation between government of Nigeria and the multilateral banks. And if there's going to be a change in the procurement method, then we have been advised by the Islamic Development Bank. It will trigger a process that will go back to their board and will take several months more. It will mean that for the next 12 to 18 months, because the loan that allowed us to have the 90 million is constructed within an agreement that was signed between Nigeria and the multilateral banks, and that had the legal opinion of the Attorney General and their board of the Islamic Development Bank. They would have to take it back through their processes, back to their board, to change that. We can choose that route, but I would like the committee to be aware that this will take at least another 12 to 18 months before then we relaunch with a new procurement method.
It's so bad. Because if UNOPS here can tell us as a country that they cannot tell us what the local manufacturer have done that made them to disqualify this local manufacturer. See, the reason why all of us are here is because of one thing, Nigeria. If it's a grant or aid, we won't spend our time. Why we are here because it's a loan that we are going to pay back. With interest. With interest. That is the pain. If we don't pay this money, our children will still pay for it.
In evaluating, particularly the bed nets, there were issues. For the anti-malaria drugs, all the anti-malaria medicines have been procured. And all local procured medicines, and I want that on record, that we procured local medicines here in this country. And actually, the first time an international organization is doing that. And we procured local medicines here, and all of them have undergone quality control testing. And we've written to the National Malaria Program to bring the distribution list so that the local manufacturer can distribute that. So local manufacturing and procurement of medicine has been done.